Good morning. How are you today? So today we're going to talk about continuing to learn and how we learn every day, and we learn new things, and how where we learn is important, and what we learn, is important. And some of the sources that people learn from, we worry about, like Dr. Google or Dr. WikiLinks, we joke about in our profession. And every once in a while, I just go to Dr. Google and look at something, or Dr. WikiLinks and look at something, because, it's a good basic place. And then we have to go from there and add more stuff. And so the other day, I had heard about a meeting in Colorado, and was talking to some of the people that were on that meeting, and it's how the veterinarian board, or the Veterinarian Medical Association in Colorado, of which I'm a member, because I'm licensed in the state of Colorado, so as a veterinarian, so I do have some stakeholder interest what happens in Colorado. And so, hey Jay, hi Yoko, and so I got to listen to or talk to some of the people about what happened at that meeting, and they were like talking about how they wanted to make sure that if the veterinarians approved this new law that they're talking about in Colorado, where certified animal chiropractors would not need a veterinary referral. And they were worried about how in good faith they could ever do that. And as I was listening to them talk about how they were worried about their good faith and recommending that animals be seen by certified animal chiropractors without a veterinary clearance, my shackles went up, and I was like, how, as a veterinarian, how can I not recommend that certified animal chiropractors that are trained in what is a subluxation in an animal, and how to identify the subluxation in an animal, and how to remove a subluxation in an animal, how can I not be in favor of that? And as I continued to talk to these people that were at the meeting, they said, well, they were concerned about public health. And as a veterinarian, I'm concerned about public health too. And yes, there's some diseases that animals get that can be transmitted to people. And there's some diseases that people get that, can be transmitted to animals both ways. And I'm thinking that, well, what about, diseases that can be transmitted from people to people? Are chiropractors required to be able to identify those in humans when they work on their human patients? And got to thinking about all the times that I've gone to the chiropractor when I thought maybe something was wrong, and maybe something more than chiropractic. But I go to the chiropractor, they adjust me, we talk about what I was feeling, what was wrong, and they always tell me, if you're not better, or if it gets worse, let me know, or go see your regular physician. And they tell me to go see my regular physician if X, Y, and Z doesn't happen. And so then it's back on me whether I go see my chiropractor or my regular physician again. And that's where this should be in the veterinary world. One of the things that everybody's worried about is rabies. Now, I've had the awesome opportunity. I've been a veterinarian for 28 years. I've seen 2 cases of rabies in my life. One was at vet school. Yeah. Misdiagnosed by board certified surgeons, 2 of them. A couple board certified internal medicine people, a couple residents, the veterinarian out in the field, they all missed it. So how could we train a chiropractor to get that? The case that was involved in it was school. 120 people were exposed. But what would have happened if that horse would have got chiropractic care right away? It might have been identified sooner, and it might have gotten to the vet clinic sooner, and it maybe would have been diagnosed as having rabies sooner, and maybe not 120 people would have been exposed. The second case that I got was my first year out of vet school. Yeah, I've been out for 28 years. I saw 2 in 1 year, and I haven't seen any since. Second one, it was a baby calf. I misdiagnosed it, thought it was scours. As I left, I thought, maybe that's not what it is. So I told the clients, hey, if this calf dies, give me a call. It died. Went out, did a necropsy. Ended up sending its brain in. As I'm doing the paperwork to send this baby calf's brain in, 2 of my bosses, now remember, I'm just out of school. My 2 bosses, one's been in practice for like 30 some years, getting ready to retire. The other one's just buying the practice. He just hired me. He's been out for like 12 or 14 years. They both looked at me and said, you are wasting these people's money. Wow. 2 veterinarians that know more than me said, you're wasting these people's money. And I thought, maybe I am, but maybe I'm not. I don't know. I'm going to send it off. So I sent it off. And in Iowa, the highway trooper comes and gets the brain, and they transport it to the diagnostic lab. And less than 48 hours later, I got a phone call from the lab, the rabies lab. We need to know everybody that was exposed to that calf because it was rabies positive. So ended up being the farmer, his pregnant wife, and I all had to get shots. But did I diagnose it at first? Nope. But what I told the people was, if this animal doesn't get better, let's do something different. If I had known chiropractic at that time, I would have adjusted that animal because he probably had subluxations. I don't know. I couldn't even tell you if he had subluxations at that time. But he wouldn't have gotten better because it wasn't chiropractic. And that's the thing, that a certified animal chiropractor has learned what is chiropractic and what is not chiropractic. So in my 28 years of being a veterinarian, I have seen 2 cases of rabies. I average probably, let's just be on the conservative side, I see 20 animals a week, 52 weeks a year. They all come to me because they're neurologic, because everything is neurologic. That's a different post. But the nervous system controls every organ in the body. So if there's an organ that's not working properly, it's got a neurological component. Do some of them need surgery? You bet. Do some of them need life-saving drugs? You bet. But that's what they are. They're life-saving because the body has the innate ability to heal itself. And that brilliance that made those 2 cells become an animal didn't leave at birth. It's still here. It didn't leave when you got sick. It's still there. It's just hampered. The body makes no mistakes. It is reacting to its environment to protect the organism, whether that's me or you or a dog or a horse. All right. So as being trained in both veterinary medicine and animal chiropractic, I know that there's way too many animals running around out there that have vertebral subluxations, that their nervous system are not operating at the ultimate level. They are all operating below normal. And we've got some cool stuff going on right now. We've got some studies going on in some dairies where we're seeing that cows are coming to heat a day and a half earlier when they get their sacrums adjusted versus non. That's huge from an economic standpoint. That's huge from a public health standpoint, because if we can get these cows pregnant, they make milk more. It's safer for the cows that we do slaughter. It's just better for the cows. They don't, it's less suffering. I mean, when my sacrum's out, it hurts. Hurts to walk, hurts to do all kinds of things. If these cows aren't getting bred back, they're open, they have more chances of getting an infection, they have more chances of getting uterine infection, which leads to mastitis. Mastitis ends up in the milk supply. We got problems. Public health. Public health. The 7 diseases that they talked about, rabies. Okay, rabies, like I said, Most of them's been messed up. West Nile virus. You know, West Nile virus, when we had the last episode up in Northeast Dallas, it was probably about 8 years ago when I was working in a traditional clinic yet. Every West Nile virus horse that came in, we adjusted. We treated them traditionally, but we also adjusted them. The ones that we adjusted that came in to get treated to the clinic all got adjusted. The ones that got treated in the field didn't get adjusted. The ones that got adjusted healed faster. You know, was it a double-blind study? No, it was evidence-based medicine. Evidence-based medicine. What is evidence-based medicine? Evidence-based medicine is we do something and then we see what happens. Homeopathy is evidence-based medicine. You know, let's learn about homeopathy, embrace it, because there's some really good stuff out there that traditional medicine can't have. Oh, and by the way, digitalis, it's a homeopathic remedy. Hasn't changed from the very beginning. We still use it just like the homeopaths do. Anyway, equine herpes virus, that was another one. Let's see, if veterinarians were so good at equine herpes virus, then we wouldn't have these outbreaks that started at places like, oh yeah, the quarter horse world, you know, where all these horses, how many board certified veterinarians, how many equine expert veterinarians were at that show? You know, a ton of them. And then these horses all go home and boom, next thing we know, all these horses have been exposed to this equine herpes virus. And if the germ theory was great and was truly the way that we say it is, every one of those horses at the world should have got sick, but they didn't. And we know that some of the horses that got adjusted never even missed a beat because their immune system was able to fight off that challenge. All right. Also, we know that we had a student at the time that was adjusting horses that came in to their clinic that with West Nile virus. Her clinic got quarantined, but she didn't lose a single horse. All the clinics in her county lost horses, but not her, because she was adjusting them. She was treating them traditionally too, but she was adjusting them, boosting their immune system, allowing that body's innate ability to function without interference. All right. Brucellosis. You know, yeah, that's important in Colorado because we've got brucellosis out there. But, you know, the most common person right now that gets brucellosis is a veterinarian. You know, when I went to school 28 years ago, we had to learn how to treat brucellosis because our guy that taught bacteriology said, you know what? Brucellosis is almost eradicated in the United States. Most medical doctors don't know how to treat it. So you better know how to treat it in people, because if you get sick with it, you're going to need to know how to treat it. So, you know, things like this. One of the other diseases was tularemia. All right. Tularemia is going to cause a high fever. So, you know, some things that you're going to adjust that dog, adjust that horse. It's got a high fever. You know, maybe we need to get the vet out and look at concurrent care. But we have to embrace. So if you're telling your clients to not do homeopathy, to not do chiropractic care, to not do X, Y, or Z, think about where you learned that. You know, I learned not to go to the chiropractor when I was a kid. Don't go to the chiropractor, they'll hurt you. Where did I learn that? Well, take a look, guys. There's a movie out called Doctored. We make all our students watch it. It's awesome. It talks about how the AMA actually had a concentrated effort to get rid of chiropractic, okay? Because, let's face it, what drug company can make money if everybody does chiropractic care? Nobody, all right? You know, if all the chiropractors united in this country, they still wouldn't have the amount of money to lobby that the drug companies have. You know, sorry guys, that's just the way it is. Veterinarians, when we talk about, you know, trained people and all this stuff, I had a guy call me the other day and offer to sell me a new surgery piece of equipment that I could use. Said I don't know how to use it, so I don't know that it would benefit me. He was willing to come out and teach me how to use it. He said, just line up a bunch of surgeries for the day. We'll come out. I'll bring the machine out, teach you how to use it, and it'll be fine. I said, great. So where did you go to vet school? Oh, I didn't go to vet school. He works for a drug company. He got trained by the company that sells the equipment, and now he's out teaching veterinarians how to use it. But yet we can't go see a chiropractor. We're not going to refer our pets to chiropractors that have AVCA certification, that have taken a national board exam, that know what is chiropractic and what isn't chiropractic. You know, until we learn what, as veterinarians, until the veterinary profession learns to identify what a vertebral subluxation is and what it does to the body and how it affects the nervous system. I mean, come on, guys. How many of you veterinarians out there really enjoyed neurology in vet school? You know, not very many. You know, oh my God, I hope it's not neurological. That's what we used to always say because we didn't have very much to take care of it. Hey, Bill, glad you made it. Philip, glad your wife enjoyed us at the AVCA. All right, Vince, good day. Let's embrace learning. Don't be afraid, because sometimes when we say, no, don't do that, we're afraid. And what are we really afraid of? Let's see. The average animal in a traditional veterinary clinic comes in twice a year. The average animal in a chiropractic practice comes in 6 to 12 times a year. So if I'm doing traditional medicine on these animals, I see them twice a year. If I'm doing chiropractic medicine on these animals, I see them 6 to 12 times a year. Which one is going to allow me to see more changes in these animals? Which one is going to allow me to be on the spot when there's something going on that might be a zoonotic disease? I think the chiropractic practice is going to be more likely. I'm going to see these animals sooner, more often. So I'm going to notice these changes. I'm going to notice herd changes. You know, those are the kinds of things that we see when we go out on a routine basis. You know, we go out and look at the whole animal. We don't just go out and look at what's wrong with the animal, right? So don't be afraid to embrace these things. I used to be that way. And then I learned about some stuff. And some of the alternative therapies that I've learned about don't make any sense. Some of the alternative therapies that I've learned about make a huge amount of sense. Some of the drugs that I've learned about make a lot of sense when they're used appropriately. Some of the drugs I've learned about don't make any sense. You know, some of the surgeries are necessary. I've sent a lot of animals to get surgery. I've also sent a lot of animals to rehab. And part of rehab is chiropractic, because that's the fastest way to affect the nervous system. You know, there's two ways we can get muscle atrophy. We can get muscle atrophy because of lack of use. We can get muscle atrophy from lack of innervation. Lack of innervation is an interference in the nervous system. Without removing that interference in the nervous system, that muscle can't get tone again. Muscle tone is important. We have to have muscle tone in order to function, you know? So education is important. We have to embrace people that have education in areas that we don't. We need to be able to learn together. We need to be able to see what each profession has to offer and not panic. You know, a veterinary clearance. I heard one gentleman say once in a Senate hearing that a veterinary clearance was no big deal. And if he'd seen an animal in the last year, he would have no problem writing a veterinary clearance for these animals to go see a certified chiropractor. Wow. How's that going to help prevent zoonotic diseases? How's that going to help? You know, the incubation period on rabies is 6 months at the most. So if I saw an animal a year ago, I don't know if he's got rabies or not. West Nile, you know, we're talking about 10 to 14 days. So a veterinary clearance that was written 6 months ago isn't going to help in those cases anyway. So we really need to embrace what each profession has, whether that profession is a certified animal chiropractor, a licensed veterinarian. As veterinarians, we need to do our due diligence. We need to make sure that the people out there are protecting the animals that are trained. In Texas right now, a certified animal chiropractor, it doesn't matter if you're a veterinarian or a chiropractor, isn't supposed to advertise animal chiropractic. But yet lay people with no training, there's a gentleman in my area that watched somebody do it. He'll tell you, I watched somebody do it. Now I am one. But the board won't go after him because he doesn't have anything to lose. How does that protect the public? So our boards, professionals, our job is to protect the public. I agree. Public health is very important, part of veterinary medicine. Our job used to be to protect the food supply. How have we done that? How many veterinarians actually even look at food animals anymore? So we're not helping. We have consultants that fly in once a year and look at these big feedlots. And then after that, the rest is just taken care of by lay people. So how does that protect the public? We say one thing and then we do another. Come on, people. If we're in a position to educate people, we need to educate people. If we're in a position to where we're trying to learn, we need to be learning every day, because somebody once told me that if we quit learning, we're dead. So as a stakeholder in Texas, as a stakeholder in Colorado and in other states that I'm licensed in, I ask myself, how can we not afford to support certified animal chiropractors? How can we not afford to do it? Because if they ever sue us, we might even lose what we've got. Because the chiropractors and the medical doctors have fought for a long time. And guess what? The courts have said, you guys, medical doctors, cannot badmouth the chiropractors anymore. And guess what? Now that we've got some studies out there, what's the best cure for back pain in humans? Not drugs, not surgery, chiropractic care. It does a lot of other good things too. So as a stakeholder, I ask myself every day, how can we not embrace certified animal chiropractors? How can we not promote the human-animal bond by promoting more visits per year? Because then as an animal chiropractor, we can pick things up sooner. Okay? We can find things. One of my peers just sent a case where the people brought a dog to her. It had a veterinary clearance from 2 months ago. Came in. This certified animal chiropractor looked at the dog, adjusted the pelvis, but the dog was in a lot of abdominal pain, a lot of problems peeing. Okay? Told the lady, you know what? You probably need to go see your veterinarian. So the lady went, saw her veterinarian. The dog had a raging bladder infection, including some stones. Got all that taken care of. Boom. How long would it have taken her to go to the veterinarian if that certified animal chiropractor hadn't taken care of it? We see things all the time. Oh, he's always been that way. No, that doesn't make it right. We need to do things. We need to embrace. We need to learn. We have to educate. Part of educating is learning. So if you're going to educate somebody about why not to go to the chiropractor, you better learn why they should go to the chiropractor. Because I know when to do exploratory surgery and when to not do exploratory surgery. Because I had to learn that. I know when to use XYZ drugs. And I also know when to not use XYZ drugs. And I took it upon myself to learn something about homeopathy. And I know when to use some homeopathic remedies. And I also took it upon myself to learn chiropractic care because I had some awesome mentors that really taught me well what the chiropractic adjustment does and what that does to the nervous system. And when I learned that, I now know what is chiropractic and what is not. And until somebody knows what is and what is not, you should not be telling people to not go see the chiropractor. And I don't care what profession you're in, whether you're in the medical profession or the veterinary medical profession, we need to learn what these things are. Because there's good cold lasers, there's bad cold lasers. There's good drugs, there's bad drugs. There's drugs that should be used for X and drugs that should be used for Y. There's homeopathic remedies that do X, and there's homeopathic remedies that do Z. And there's chiropractic adjustments that remove vertebral subluxations and allow the body's innate ability to function without neurological interference, the way that it was born to do, the way that it was made when the two cells united. And that's what chiropractic is about. Chiropractic's not about diagnosing. Chiropractic is not about taking money away from veterinarians. Chiropractic is about helping the body function at its utmost ability. Sometimes it needs help, but most of the time, doctor, do no harm and stay out of the body's way. So today, learn, teach, and heal, because we're healers, every one of us. Let's use it to our utmost ability. Thanks for joining. Hi, Ann. Hi, Julianne. Lance. Shannon, glad you made it. Guys, we'll see you next week, and thanks for joining.